Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapoose. On this episode, I'm joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I'd like to remind everyone we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Morning, Sheena.
Happy Friday.
Yay for Friday. Everyone's favorite.
So we kind of had like a lot of news going on in the last day or two. For the first piece, can you talk about the Pfizer vaccine being approved for the use of, is it 12 to 15 now?
12 to 15, yeah, that's correct. So this last week, the FDA gave the EUA, the Emergency Use Authorization, for the Pfizer vaccine to be lowered from 16 years old to include the age group of 12 to 15. So now 12-year-olds can receive the Pfizer COVID-19 vaccine and they can be vaccinated against it. They've found the efficacy for it is right near 100% for all practical purposes. So it's, really good at helping, prevent your younger children or your younger teens from getting COVID.
So, is the tribe going to be trying to get Pfizer now that it's been approved for younger children?
Yeah, so Dr. Schlegel and our emergency medical director already requested Pfizer. The ordering's kind of funny on, when you can get specific vaccines from DHS. So hopefully we'll have them by the 20th, which would just be next week, given the date today. And so by next Friday, we're hoping we have some of the Pfizer vaccines. Dr. Schlegel's already received phone calls and stuff at the clinic of individuals that want their teens to be vaccinated. So that's really encouraging for helping, prevent the spread within the community.
So, what research was done, or how do we know that this vaccine was safe for this age group? How did they get to this conclusion?
So Pfizer conducted an additional phase 3 trial on the vaccine. They had 2,260 teens ages 12 to 15 enrolled for the efficacy of the vaccine. Like we mentioned earlier, it prevents infection almost 100% of the time. With that control group, they also found very few reactions, if any at all. They were very minimal. And they've deemed it safe for broader application and adoption. And right now they're currently doing additional phase 3 trials for ages 6 months to 11 years old. So they want to see if the vaccine is safe enough for the entire broad spectrum of individuals that are open for vaccination. So they've run trials. They're also, continuing to watch those teens for any long-term conditions that may crop up. But so far there haven't been any that they've had to report or that they've seen in their control group.
So will the dosage be any different for children than it is for adults?
No, the dosage, I can talk. The dosage is still going to need to be 2 doses given approximately 4 weeks apart from each other. Additionally, the children will be observed for 15 minutes after they receive each dose, and that's just to make sure that they don't have any sort of anaphylactic reaction, which is what adults are experiencing right now when they go to receive those vaccines. So it'll be same across the board for them.
So the other big piece of news that came out yesterday was the CDC changing their masking guidelines. Can you just go over that?
Yeah, so as far as their new guidelines, they say that fully vaccinated individuals can resume activities without wearing masks or physical distancing, except where required by federal, local, or tribal laws or territorial laws and regulations. So right now, the tribe still has a mask mandate in effect, but that is something that we're going to reevaluate given the new recommendations and the level of individuals that have been vaccinated. So that's going to come up later in incident command. One of the things they do bring up, though, for individuals that aren't vaccinated, they say a mask's not a substitute for social distancing, and that masks should be worn in addition to staying 6 feet apart, especially when you're indoors with people that don't live in your household. So if you haven't been vaccinated, you carry on with, or should be carrying on with, the same level of caution that you've had recently, or that should have been exercising recently. And they say that, those masks should definitely cover your nose and mouth, fit snugly against the side of your face without any gaps, and be worn anytime you're traveling on any sort of public transportation, planes, buses, trains, or things of that nature.
So to be clear, this hasn't changed the mask mandates for the tribe yet?
The tribe has not yet changed their mask mandate, but we will be discussing that on Monday.
Okay. And I guess a lot of people are very surprised by the news that the CDC has changed their guidelines. I know this is off the cuff, but can you, how did they come to this conclusion? What are they looking at that is showing them that we can take this step now? Versus last time it was very mild, and then we're free reign.
They've had more time to observe the effects of the vaccinations on the communities and the populations. They've also been able to observe several states like Texas and Florida that haven't seen spikes in the number of COVID cases, and they've abolished their mask mandates and lifted a lot of their COVID restrictions that were in place previously. And so they're seeing in real time that the vaccines are effective, and we can probably lift a lot of the previous restrictions on populations. And so that's kind of where they're revamping that or taking that stance from.
So to me, there wasn't a lot of really clear instructions the way that there was in the past. They were just kind of return to pre-pandemic life, which I think is
really
kind of hard
when I read.
to
I was like,
believe.
that's very broad and open-ended. But all right.
So do you think that we're going to hear more detailed instructions in the future, or is it just kind of they're
over
stepping
and
back
done
at
with?
this
Or
point?
you
Yeah.
That's a really good question, and I would say that the big question deals with the variant spread at this point. It doesn't seem to be a huge percent of COVID cases, especially here in Wisconsin. We've tested roughly 900 cases for variation in genomics, which is a little less than 1%. And it doesn't seem like the variants tend to be spreading very quickly through the U.S., and that's great. I know one of the things that people were worried about was how effectively the vaccines would fight off the variations, but it seems like they're doing a pretty solid job of that at this point in time.
Okay. Well, is there anything else that you want to add before we wrap this episode up?
If people have additional questions, we can definitely put some of the links to the CDC recommendations and information in the show notes. We would just recommend that, everyone work to get vaccinated as soon as they possibly can. Just for my family, we took our daughter and got her vaccinated yesterday. The tribe doesn't have the Pfizer vaccine yet, but I know it's available at places like Walgreens and CVS and other pharmacies. And so if you can't wait until the 20th, you might want to consider booking with them and seeing if you can get in, because it really will help everything return to normal faster, I think. So keep that in mind, and keep your family and yourself healthy and safe.
Thank you, Vaughn.
Hey, thank you.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. I do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Again, please send those to us at podcast@mitw.org.